Now, for those of us at an age when screening for cancers becomes part of a yearly checkup, it's something we don't often look forward to.
So what are the pros and the cons of regular screening? And is there any way we can avoid the annual scan? What's over-screening, which is an interesting part of the discussion as well. Oncologist and medical writer Dr. Ranjana Srivastava is going to be joining us for regular health discussions, and she joins us now. Ranjana, good morning.
Good
nice
morning.
to see you.
Good morning.
This is an interesting concept. First of all, when you hit your 40s and then your 50s, what are the regular screens that your doctor, your GP might suggest?
So the government recommends 3 particular cancer screenings. One is for breast cancer with a mammogram, which is recommended every 2 years for women between 50 and 74. Bowel cancer screening, which is with fecal occult blood testing, where you send in a sample of your stool, which may be followed up by a colonoscopy. And thirdly, pap smears for cervical cancer. Your audience may have heard about other screenings, such as lung cancer screening, which is still quite controversial because we haven't quite reached the right population we need to screen for. Things like ovarian cancer, which have no good screening tests,
exactly.
and PSA, of course, for men, which continues to be a lively debate in the medical community about its pros and cons.
Which is for prostate cancer.
That's correct.
And then also there's the regular suggestions your GP might make to get that, get your skin regularly checked in case any moles are looking troubling or the like. It's all a very involved process and a very expensive one too.
And anxiety-provoking. So I should mention skin, which is particularly important in the Australian setting as well. Yes, for skin checks, yes.
Now, for people who are a bit too overly health conscious and take the screening process potentially a bit too far with regular screenings, is there any harm in that?
I'm glad you asked that, Michael. Yes, there is. I mean, the screenings that exist for cancer are obviously screenings that have been proven to have some health benefits. But I think that overdiagnosis is a problem, and the harm from screening really needs to be considered before you have the screening test. Because, for example, let's take an example of a mammogram.
Yeah.
So it's said that for every 10 sequential mammograms that a woman will have in her lifetime, there's a chance about 1 in 5 of returning a false positive result. Now, that may be followed up by further testing, by a biopsy, and the numbers are small but real. Some women will end up having surgery, radiation, or even chemotherapy for a cancer that may not really have been important in their lifetime. The problem is finding out who those women are and how to balance that risk versus the harm, the benefit.
So the harm is the intervention itself?
So a number of things. The intervention, which can be costly, time-consuming, but even if you have had a brush with cancer and it's disproven, research shows that the anxiety from that can last for years and can be really deeply impacting on people.
And we know that anxiety stress actually is a major health issue as well, which can cause its own problems.
Yeah.
Is it true, as some doctors have in conversations that I've had with them on this program and elsewhere, that there are some what you might call, cancerous cells or very, very early cancers that are detected that don't necessarily always need to be dealt with? They may just not turn into anything.
Yeah, so this is the whole issue of overdiagnosis. Overdiagnosis essentially means diagnosing a serious illness which was not going to have a consequence within your lifetime. Right. So some doctors would say, you might die with the cancer rather than of the cancer.
So if we're talking about an older person, for example?
People who are not just older, but people who have multiple chronic medical conditions. So, for example, PSA screening or prostate cancer screening is a good example that is used. If you screen someone who is asymptomatic with a PSA test and then you subject them, so it's said that for 1,000 men who will be screened for prostate cancer, about 2 will avoid death from prostate cancer, but approximately 25 people will undergo treatment for that prostate cancer. It may be with radiation, it may be with surgery, and that has real risks, bowel dysfunction, impotence, incontinence. So I think before one has any kind of a screening test, you need to understand why you're having it, what will the results show, and what will you do with the results.
And where's the best advice for that from, the local GP?
I think that all these conversations begin with a good GP.
Yep.
Begin with your GP who knows your history, who is more likely to be familiar with your overall history than someone who is just seeing you for a test.
Yep.
And all these tests should be done in the context of your overall health and what you expect to achieve.
when you get the result of a test, that can sometimes be alarming, of course, based on what's discovered. What's the best process to go through after that? I mean, when you're in that difficult position of deciding, okay, this has been detected, but the GP's telling me, look, it's not that, it looks like a big deal on paper, but it's not that big a deal. But you need to go out into the world and have the strength of mind to be able to live with that and not let the anxiety overtake you.
That's a tough one. I mean, I do this all the time, and I'll see people and I'll say, well, the test shows something, but we need further tests to elucidate what this really means. I think, firstly, it begins in the doctor's office with a good explanation, and I think that can go a long way towards allaying people's anxieties. And then, as to how a patient copes with this, I think it comes back to understanding and having a good conversation and trying in the room to figure out what it is that you need to know, what is the evidence, what other tests will happen, because I think a lot of people go out not knowing and not understanding what took place in the consultation.
I think the advocacy that you need to exhibit for yourself as a patient in getting the care that you want is the really hard thing.
Well, the best patient
That's a conversation we should have one day.
Patient.
Yeah, exactly.
Absolutely.
A lot of stuff to talk about. No, always nice to see you, Ranjana. Thanks so much.
Thank you, Ranjana.